Okay, let's unpack this. When we talk about oncology, it's so much more than just a single disease.
Oh, absolutely.
It's a vast, ever-expanding universe of cutting-edge science, deeply personal human stories, and, well, relentless innovation that touches virtually all of us in some way.
It really does.
Today, we're taking a truly comprehensive deep dive into an incredible collection of sources that illuminate nearly every aspect of cancer. We're talking from its very origins in our cells to the most advanced treatments being developed, the critical and often overlooked role of patient well-being,
Mm,
and even the intricate legal and ethical considerations that shape how care is delivered around the world.
it's a huge scope.
It is. So whether you're simply curious about the latest breakthroughs, maybe actively looking for specific information related to cancer care, or, just want to feel more thoroughly informed about a topic that impacts so many lives, we've sifted through a mountain of details to bring you the most surprising facts, crucial insights, and hopefully some practical takeaways.
Indeed. And what's truly compelling here, I think, is how these incredibly diverse perspectives, you mentioned the biology, the clinical realities, the patient experience, even the societal frameworks, how they all interweave to paint this really comprehensive and nuanced picture of oncology today.
Right.
We won't just be presenting facts, we'll be sort of connecting the dots between these seemingly disparate areas,
Yeah.
showing you not just what is happening at the forefront of cancer research and care, but crucially, why it matters so profoundly for individuals facing this challenge and, well, for the future of medicine as a whole.
Understanding the whole ecosystem, really.
Exactly, the entire ecosystem of cancer.
So let's begin our journey at the absolute beginning.
Yeah.
What is cancer at its most fundamental, its cellular level? Our sources describe it in a really vivid and, I think, relatable way as a group of cells that don't want to work in team.
That's a great analogy.
Yeah, imagine your body is this perfectly synchronized orchestra, right? And then suddenly certain sections just decide to play their own chaotic tunes, ignoring the conductor, ignoring the rest of the ensemble.
Pure disruption.
Exactly. These are like rogue agents within our own bodies, disrupting the harmonious function of our systems, growing and spreading without any regard for the greater good of the organism. And here's where it gets really interesting and frankly, a bit astonishing.
Okay.
We learn that a significant portion of our human genome, about 27%, that's nearly a third of our entire genetic blueprint, is inherently linked to cancer development.
27%. That's staggering.
Isn't it? This isn't just about external exposures. It tells us that the potential for cancer is fundamentally genetic, meaning the predisposition, or kind of the raw cellular machinery for it, is often built right into our very DNA, right from birth.
So it's baked in to some extent.
To some extent, yes. Then external factors like smoking or certain environmental toxins, they act as triggers. They activate these pre-existing, maybe dormant genes.
Right, the switch gets flipped.
Exactly. It's not just about what we're exposed to, it's about how that exposure interacts with our inherited cellular instructions. It reveals this deep, complex interplay.
That's a crucial point. And it immediately makes you wonder, right? If cancer has such a strong inherent genetic basis, how does this predisposition actually manifest? What are the specific genetic mechanisms that lead to this cellular rebellion you described?
Yeah, how does it happen?
Well, our sources illustrate this as a delicate, often precarious balance, or maybe more accurately, a constant microscopic battle raging within our cells.
A battle. Okay.
This battle involves two opposing forces, oncogenes and tumor suppressor genes.
Oncogenes and tumor suppressors. Got it.
Let's think of proto-oncogenes first. Everyone has these. Think of them as dormant, bad genes. They're like unprimed engines, perfectly capable of accelerating cell growth, but thankfully they're usually kept in check.
Dormant potential.
Exactly. But when these proto-oncogenes are exposed to specific external factors, could be carcinogens, certain viruses, even lifestyle choices, they can mutate. When that happens, they transform into full-fledged oncogenes. These then actively push cells to form tumors, relentlessly incentivizing uncontrolled, rapid growth. They are the gas pedal for cell division, essentially stuck in the on position.
Gas pedal stuck on. Not good.
Not good at all. And a particularly striking example mentioned in our sources is the ROS oncogene. A single point mutation in ROS, just one tiny building block of its DNA swapped, can make it rogue.
That's one change.
Just one. And this mutated ROS is found in a significant proportion of human tumors, about 15–20% overall. And its frequency skyrockets in certain aggressive cancers, like 90% in pancreatic adenocarcinomas and 50% in colon cancers. It really underscores how a seemingly small genetic change can have a devastatingly large impact.
Wow, 90% pancreatic.
On the other hand, we have tumor suppressor genes. These are truly the good guys, the cellular equivalent of the police force, or as one source vividly describes them, the brakes in the cell cycle.
The brakes. Okay, so gas pedal and brakes.
Precisely. Their fundamental job is to actively inhibit tumor formation. They ensure cells divide correctly, repair damaged DNA, and stop proliferating when they should. Iconic examples here include p53, often called the guardian of the genome, and RB.
Heard of P53?
Yeah, it's crucial. These genes are meticulous regulators of cell cycle progression. They can halt division if DNA is damaged, initiate complex repair mechanisms, and if the damage is beyond repair, they can even trigger senescence, where cells permanently stop dividing, or apoptosis, which is programmed cell death. Suicide, basically, for the cell's own good.
Wow. So they prevent dangerous cells from multiplying.
That's the idea. So the development of cancer, then, hinges on the outcome of this intricate battle. If tumor suppressor genes fail, maybe through mutation, deletion, or inactivation, the oncogenes can gain the upper hand. That leads to unchecked runaway cellular growth.
The brakes fail, the gas pedal is stuck down.
You got it. And here's a crucial point highlighted by the double impact theory, which kind of illuminates the interplay between inherited risk and environmental factors.
Double impact. Okay.
While oncogenes typically aren't inherited, they usually arise somatically from mutations during a person's lifetime. Tumor suppressor genes can be hereditary.
Ah, okay. So you can inherit faulty brakes.
Exactly. Like with a BRCA gene in breast cancer. This means you might start with one hit, a weakened defense, a brake pedal that's already halfway broken, so to speak.
Right.
Then, environmental or lifestyle factors, smoking, sun exposure, poor diet, become that second hit. And that significantly increases your risk, potentially leading to the full-blown development of cancer.
So it's genes and environment often working together.
Precisely. This interplay helps clarify why some people with certain genetic predispositions never develop cancer, while others do. It often requires more than just one factor aligning in a detrimental way. It underscores that cancer isn't just, bad luck. It's a complex dance between our inherited vulnerabilities and the world we live in.
That makes a lot of sense.
And zooming out, these fundamental cellular changes, the activation of oncogenes, the failure of tumor suppressors, ultimately lead to what are universally known as the hallmarks of cancer.
The hallmarks. I've heard that term.
Yes. And what's truly insightful about these hallmarks is that while cancer cells are incredibly diverse in origin and type, they all converge on these same sort of superpowers to survive, grow, and spread.
Like a common toolkit for being cancerous.
Exactly. A shared toolkit. This convergence represents a universal Achilles heel that researchers can target. Cancer cells acquire unique abilities. They become resistant to natural cell death processes. They exhibit genomic instability, meaning their DNA becomes highly mutable, leading to more mutations.
Making them evolve faster, almost.
In a way, yes. They actively promote angiogenesis, essentially growing their own new blood vessels to get nutrients.
Building their own supply lines.
Right. And they learn to invade surrounding tissues and metastasize, spread to distant parts, often by losing their normal cell-to-cell connections, allowing them to detach and travel.
Scary stuff.
Critically, they also develop sophisticated ways to evade our immune system, often by mimicking normal cells or producing signals to trick immune cells.
Hiding in plain sight.
And perhaps most fundamentally, they can proliferate indefinitely without external growth signals, essentially becoming immortal, dividing without the usual checks and balances.
Immortality, but the bad kind.
Precisely. Understanding these shared hallmarks across all cancers allows for the development of broad, powerful therapeutic strategies that can target these common vulnerabilities.
Okay, so understanding the enemy at its most fundamental level is one thing. But then comes the critical challenge. How do we find it? And once found, how do we understand its reach, its severity within the body? This deep dive really illuminates that critical, often meticulous process of cancer diagnosis and staging.
Absolutely vital steps.
Our sources emphasize that this phase is fundamentally about thinking about cancer and proactively looking for it. Why? Because in many of its most curable stages, symptoms often don't appear early on.
That really underlines the immense importance of awareness, regular screenings, early detection campaigns.
It really does. So we learn about various diagnostic tools, each precisely calibrated for a specific purpose. For instance, a fine needle aspiration, or FNA biopsy, is often used for cytology. That's examining individual cells extracted from a suspicious area, like getting a quick snapshot.
A quick look at the cells themselves.
Right. In contrast, a core needle biopsy is typically preferred for histology. Here, a small piece of tissue is extracted, allowing doctors to study the cellular architecture in its broader context.
Like analyzing the building blocks of a house, not just a single.
Good analogy. And this distinction is particularly important for suspicious non-palpable lesions, maybe found incidentally during a mammogram, where you need that precise tissue analysis.
You need the context.
Exactly. Our sources detail a careful, structured algorithm for investigating palpable tumors, where the approach thoughtfully varies depending on a patient's age. For individuals over 35, both mammography and ultrasound are typically used to get a comprehensive view.
Hmm.
But for those under 35, an ultrasound alone is often the initial step. Why? Because younger breast tissue is often denser, making mammograms less effective at distinguishing things.
Right. Harder to see through on a mammogram.
If a mammography result comes back, BRADS 4 or 5, that's the breast imaging reporting and data system score indicating high suspicion for malignancy.
High suspicion, okay.
Then the patient is immediately referred to a specialized gynecologic oncology unit for more targeted evaluation. If, during this process, the mass turns out to be just cystic, a less invasive procedure, like a simple puncture to drain it, might be done.
So it's a step-by-step process.
A meticulous multi-step process. It ensures that what's happening at the cellular level is confirmed with utmost precision, guiding those crucial next steps.
That's an excellent breakdown of the initial steps. And once a cancer is identified, its cellular nature understood, the very next crucial question becomes, how do we assess its severity? How far has it spread?
Right. The extent of the problem.
This is precisely where the TNM staging system comes in. It's a globally recognized and standardized classification.
TNM, what does that stand for?
T is for tumor size and invasion. N is for lymph node involvement, has it spread to nearby lymph nodes. And M is for metastasis, has it spread to distant parts of the body.
Tumor, nodes, metastasis. Okay.
This system helps clinicians determine the disease's stage, typically ranging from stage 1, which is minimal or localized, to stage 4, which unfortunately signifies very advanced disease, often with distant metastasis.
Stage 1 to stage 4.
And what's particularly striking and incredibly valuable here is that preoperative staging aims to know the stage before treatment even begins.
Knowing before you start. That sounds critical.
Absolutely crucial, because the stage directly correlates with prognosis, basically, the probability of survival and the likely course of the disease. For instance, a stage 1 tumor, typically small and localized, often boasts an over 90% survival probability.
Over 90% for stage 1. That's hopeful.
Very. This stark difference between stages highlights the immense value of early detection and accurate staging. Understanding this staging system gives both the medical team and the patient a clear roadmap and realistic expectations.
Takes away some of the unknown, perhaps?
Exactly. Instead of just a daunting binary cure or not cure scenario, it transforms the prospect into a more manageable, step-by-step recovery process. It offers clarity, a sense of progress.
From general fear to a specific plan. I like that.
Our sources provide compelling examples of unique metastatic patterns in different cancers, too. For breast cancer, common sites of metastasis include bone, lung, liver, and brain. So doctors monitor these areas specifically.
Targeted surveillance.
Right. We also delve into the molecular classifications for breast cancer, which go beyond just size and spread. They define the cancer by its biological characteristics. Types like luminal A and B generally have better prognoses, often hormone responsive. Then there's HER2 positive, which can be targeted with specific drugs.
And triple negative.
And the more aggressive triple negative type, which lacks these common receptors, making it harder to treat with targeted therapies. Interestingly, our sources mention some rare types of breast cancer that can even express androgen receptors, meaning they might respond to treatments used for prostate cancer.
Wow. Borrowing treatments between cancer types.
It shows the growing understanding of cancer's diverse biology. This molecular insight is a game changer for personalized treatment.
Definitely.
For urothelial cancer, mostly affecting the bladder lining, we see how different histopathological types profoundly influence staging and prognosis. Transitional cell carcinomas are most common, but more aggressive forms like adenocarcinomas often present with muscle invasion at diagnosis.
Muscle invasion sounds serious.
It is. These muscle-invasive types tend to metastasize more readily, often through the bloodstream, leading to a much poorer 5-year survival rate compared to non-muscle invasive tumors. The distinction between non-muscle invasive and muscle invasive is absolutely crucial for treatment planning.
So the treatments would be very different.
Very different. Non-muscle invasive might involve less extensive surgery or therapy within the bladder. Muscle invasive often requires more aggressive approaches, sometimes even complete bladder removal. This deep, nuanced understanding of specific cancer types and their unique behaviors, down to the cellular and molecular level, is utterly vital for precise diagnosis, accurate prognosis, and developing truly effective, tailored treatment plans.
So once a cancer has been meticulously diagnosed and precisely staged, the journey moves into the demanding yet hopeful realm of treatment. And what's immediately powerfully clear from our sources is that cancer care is never a solitary endeavor. It's the ultimate team sport.
Absolutely. Collaboration is key.
It's never just one doctor making all the weighty decisions in isolation. It's a whole group of highly specialized professionals working together, collaboratively integrated, making sure all angles are covered.
That collaborative spirit is truly the bedrock of modern oncology.
So we learn about the core pillars, forming this robust triangle of expertise around the patient. First, the medical oncologist. They handle chemotherapy, other systemic drug treatments like targeted therapies or immunotherapies, managing the overall medication plan.
The systemic treatment lead?
Then the radiation oncologist, focusing specifically on radiation therapy using those high-energy rays precisely targeted to destroy cancer cells, minimizing damage nearby.
Precision targeting with radiation.
And finally, the surgical oncologist. Now, the surgical oncologist, as one expert explains, isn't simply about operating. Their role is much more nuanced, strategic.
They need a deep understanding of the cancer's biology and behavior.
Exactly. This allows them to decide when and even if surgery is the most appropriate path. For instance, our sources highlight anal cancer. You might instinctively think solid tumor needs surgery,
Right.
but it's often effectively treated with a combination of chemo and radiotherapy instead. It shows the surgical oncologist's expertise includes knowing when not to operate.
Knowing when other modalities are superior for patient outcomes. They're truly the strategic gatekeepers of the operating room, in the best sense.
Strategic gatekeepers. I like that framing.
Building on that, the principles guiding surgical oncology are critical for the best long-term outcomes. A primary goal is achieving free margins,
Free margins.
meaning the surgeon removes not just the visible tumor, but also a surrounding border of healthy tissue, usually 1 to 2 centimeters. The aim is to eliminate any microscopic cancer cells that might have spread just beyond the visible tumor, preventing recurrence. Pathologists meticulously check these margins.
Getting it all out, plus a safety buffer.
Exactly. Another absolutely critical aspect is lymphadenectomy, the careful surgical removal and microscopic study of nearby lymph nodes.
Checking the lymph nodes.
Vital, because lymph nodes are often the primary sites for metastasis. They act as checkpoints. Analyzing them helps determine the precise extent of the disease and guides further treatment decisions.
More crucial information for the plan.
Right. And beyond the surgery itself, the surgeon also plays a vital role in guiding the patient to necessary adjuvant therapies.
Adjuvant therapies.
These are complementary treatments, usually chemo or radiation, that often follow surgery. The purpose is to eliminate any remaining, maybe microscopic, cancer cells that weren't visible or removable, essentially mopping up to reduce the risk of recurrence.
Mopping up. Got it.
When it comes to the therapies themselves, chemotherapy is described as inherently toxic to cells. Side effects reflect this. But the ingenious part is that cancer cells are significantly more sensitive because they divide much faster than most healthy cells. This difference is what's exploited.
Targeting the fast dividers.
Precisely. Chemo can be administered in various forms. It can be oral, like temozolomide for glioblastoma, that brain tumor we mentioned, convenient for home use, or it can be via intravenous infusions, depending on the drug and cancer type.
IV or pills.
Radiotherapy, we learn, is precisely targeted to the tumor, using high-energy beams to maximize damage to cancer cells while meticulously sparing healthy tissue. An example given is using a gamma probe in endometrial cancer for incredibly precise delivery.
High-tech precision.
And hormonal therapy is another crucial tool, especially for hormone-sensitive cancers like certain breast or prostate cancers, where growth is driven by hormones like estrogen or testosterone. Blocking those signals can starve the cancer cells.
Cutting off their fuel supply.
Our sources also detail specific cancers and their tailored multidisciplinary treatments. For endometrial cancer, the typical approach often involves primary surgery hysterectomy plus lymphadenectomy, followed by careful consideration of adjuvant radiation, chemo, or hormonal therapy based on the specifics.
Tailored follow-up.
For brain tumors like gliomas, the standard path involves surgery to remove as much as possible safely, often followed by combined radiotherapy and oral chemotherapy, specifically temozolomide. That's become a standard of care.
Surgery plus chemoradiation.
This whole holistic, intricately coordinated, truly multidisciplinary approach ensures comprehensive, personalized care. It emphasizes that effective treatment is a carefully orchestrated combination, always aiming to maximize efficacy and minimize harm.
Now, cancer treatment, while undeniably life-saving and often incredibly effective, frequently comes with significant challenges, daunting side effects that can profoundly impact a patient's daily life.
It's a tough road for many.
Our sources are very candid about these realities, shedding light on what patients might experience during this arduous journey. It's not just fighting the disease, but managing the treatment process itself.
That's a really important distinction.
We hear about common chemotherapy side effects that can be debilitating, nausea and vomiting, making eating and maintaining strength incredibly difficult.
Very common.
A general feeling of profound weakness or pervasive fatigue that just, permeates everything, makes simple tasks feel monumental.
The fatigue can be overwhelming.
Beyond these, a frequently mentioned and particularly troublesome issue is neuropathy, nerve damage. Often numbness, tingling, or even shooting pain, especially in the hands and feet. It can severely affect fine motor skills, balance, overall mobility.
Neuropathy can be really difficult to manage and sometimes long-lasting.
Patients might also experience blood clots. Our sources confirm these are indeed more common in individuals with solid cancers, like glioblastoma.
Yes, cancer itself increases the risk of clotting.
And sometimes, specific treatments themselves, like the drug bevacizumab, used for recurrent glioblastoma to inhibit blood vessel growth, can paradoxically increase this risk.
Right, by affecting blood vessel integrity. It's complex.
These aren't minor inconveniences. They are serious issues requiring careful, ongoing management for quality of life.
That's an important clarification of the challenges. So, the natural next question is, how are these often debilitating symptoms managed to improve comfort and maintain quality of life during such a taxing period?
Yeah, what can be done?
Our sources offer a range of practical and evidence-based strategies. For instance, specific dietary interventions for chemo-induced nausea. We learn about anti-nausea smoothies rich in vitamin C and acidic flavors, green apple, cranberries, ginger, pineapple.
Smoothies. Interesting. How does that help?
The tartness and fresh quality are believed to help counteract that metallic taste and queasy feeling. A simple yet potentially effective dietary aid patients can use actively.
Something proactive they can do.
For complications like blood clots, the approach is more medical. Anticoagulants, blood thinners, are a common and necessary solution to prevent serious issues like deep vein thrombosis or pulmonary embolism.
Medical intervention for clots. Makes sense.
For patients with brain tumors, seizures are a significant and frightening concern requiring proactive management.
Seizures, right. How is that handled?
Prevention involves rigorous adherence to consistent anti-epileptic medication, taking it daily, on time, without fail. Patients are also strongly advised to avoid common triggers like excessive fatigue or alcohol consumption.
Consistency and avoiding triggers.
Crucially, patients and families need to be well educated on when to call for emergency help, like for prolonged seizures, and understand the implications, like driving restrictions. These restrictions, often 6 months after an event, can profoundly impact independence, adding another layer of challenge.
Huge impact on daily life.
One aspect that really stands out here is the universal, yet sometimes overlooked, advice given to patients across all treatment types. A balanced diet, adequate sleep, effective stress management. These are fundamental foundations for overall well-being.
The basics, but critical.
Absolutely. Not just general health tips, they are critical components of supportive care. They can significantly impact a patient's ability to cope, bolster their immune system, improve mental resilience.
Real important.
And critically, open and continuous communication with the medical team is paramount. Patients are strongly encouraged to call their doctors with any new or worsening symptoms or concerns, no matter how minor they seem.
Don't hesitate to call.
Right. This proactive approach helps the medical team manage discomfort effectively, address complications swiftly, and ultimately improves the patient's overall quality of life during a very challenging time. It builds that crucial partnership.
Okay, moving beyond the conventional, often intensive medical treatments, our sources open up a truly fascinating and increasingly important discussion about complementary and integrative therapies in oncology.
Yes, a growing area of interest.
It's abundantly clear there's a very high demand from patients. They're seeking solutions to improve their quality of life, alleviate difficult side effects, reduce treatment toxicities.
The demand is definitely there. Conventional paths save lives, but can be incredibly difficult, leaving patients searching for additional support.
It highlights a critical need in comprehensive cancer care that goes beyond just attacking the disease itself.
That's absolutely right. The patient desire for more support is palpable. So, from a broader perspective, the concept of integrative medicine aims to fulfill this need. It carefully combines conventional and complementary treatments under an umbrella of scientific evidence.
Scientific evidence being key.
Absolutely. A crucial distinction. It emphasizes these additional therapies should be evidence-based, not just anecdotal. Acupuncture is highlighted as a leading example, standing out with robust scientific backing.
Acupuncture. Okay.
Our sources cite an impressive body of research, over 33,000 articles on PubMed, numerous randomized clinical trials supporting its use. It's so well regarded, it's recommended by major integrative oncology societies for specific symptoms. It holds an evidence grade of 1A, the highest level for pain management and chemo-related nausea and vomiting.
Wow. Top-level evidence.
Also useful for vasomotor symptoms like hot flashes, grade 1B, and potentially for fatigue, insomnia, stress. Importantly, it's considered safe when applied by qualified professionals, though there are specific contraindications like severe low blood counts, lymphedema, or instability to ensure safety.
Qualified professionals are key.
We also learned about the ATOC approach. It's an acronym, a blend of Oriental, Occidental, complementary, and holistic techniques.
ATOC. Okay, what does that involve?
It's truly holistic. It incorporates various modalities. Phytotherapy using medicinal herbs like ginger for nausea, turmeric for inflammation.
Herbs, right.
Aromatherapy using essential oils, diffused or in baths, for relaxation, mood. Bach flowers, natural essences for specific emotional states like fear, loneliness, stress, based on Dr. Bach's work.
Flowers for emotions.
Oh.
Interesting.
And guided meditations are a core component, promoting deep relaxation, improving sleep, helping patients process complex emotions like guilt or fear related to their condition.
Mind-body connection stuff.
Exactly. And what's fascinating here is how a talk connects seemingly physical symptoms to deeper emotional or systemic imbalances, drawing on principles similar to traditional Chinese medicine. For example, a right shoulder blade muscle spasm might be linked to liver dysfunction, possibly worsened by chronic anger or diet.
Linking physical and emotional.
These therapies aim not just to alleviate symptoms, but to restore overall balance, improve quality of life by addressing those profound emotional and psychological aspects. It acknowledges the emotional burden can be immense.
Treating the whole person.
And always with full patient consensus on what they want to change or reinforce in their healing journey. Personalized.
Another significant area covered extensively is cannabis medicine in oncology.
Cannabis. A complex topic.
Our sources explicitly state it's not a miracle drug or a cure for cancer itself, but it's presented as a vital aid for severe suffering chronic pain, intractable nausea, anxiety where conventional treatments might fall short or have bad side effects.
A tool for symptom management.
Right. It's complex, over 500 molecules like THC and CBD, and huge individual variations in response.
Finding the right dose titration is highlighted as crucial, often challenging, can take up to 3 weeks.
3 weeks to find the right dose.
It's about balancing symptom control with minimal side effects like low blood pressure or rapid heart rate.
Delicate balance.
Products come in various forms, capsules, oils, sprays, offering flexibility. And critically, patients are strongly encouraged to demand a certificate of analysis, a COA,
A COA.
for quality assurance. It confirms cannabinoid content, absence of contaminants, vital because of unregulated or pirate products out there.
Pirate products. Yikes.
Yeah, they might be mislabeled, contaminated, ineffective, posing serious risks to vulnerable patients.
So buyer beware.
Definitely. So it leads us to consider, for all these complementary therapies, the emphasis is consistently on rigorous medical criteria and the principle of benefiting patients without causing harm.
Do no harm.
There's a strong ethical call for proper training for practitioners, strict avoidance of unregulated products to ensure safety and effective integration into health plans. The ultimate goal: make these therapies a legitimate part of the patient's arsenal, available safely, meeting the social demand, and crucially, maybe improving adherence to conventional treatment by easing side effects.
Empowering patients with more options for holistic well-being. Okay, moving beyond direct medical treatment, our sources deeply explore the proactive, incredibly empowering role of nutrition and lifestyle, both in cancer prevention and as crucial supportive measures during treatment. This section really empowers you with choices that can significantly impact your health journey.
Choices we can make every day.
The profound idea that cancer doesn't have who wants it, but who can, is introduced. It links cancer development not just to random chance, but to a cellular vulnerability, where our internal supervisors, our protective mechanisms, can disconnect or become less vigilant.
Our cellular defense system weakening.
Right. And our habits smoking in any form, including shisha, even marijuana due to combustion byproducts, excessive alcohol, obesity, lack of exercise, are clearly identified as modifiable risk factors.
Levers we can actually pull.
Powerful levers we can change to reduce personal risk. Age, unfortunately, is non-modifiable. As our cells naturally get older, less vigilant at repair, the probability increases.
Can't stop time.
Can't stop time, but we can certainly influence how our bodies age at a cellular level through conscious choices.
That's a powerful distinction influencing how we age. So putting this into context, nurturing our immune system through proper nutrition is seen as absolutely essential to keep cancer at bay. By consistently giving our cells the nutrients they need to function optimally.
Fueling the defense system.
The underlying concept is, if our cells get the necessary vitamins, minerals, antioxidants, it fosters robust antioxidant effects, promotes healthy regeneration, even an anti-aging process at the cellular level, prevents accelerated destruction, maintains strong cellular defense.
Keeping the cells strong.
This continuous renewal helps keep the opportunistic nature of cancer in check. Makes it harder for rogue cells to take hold.
Okay, so what specific dietary adjustments are recommended?
Reducing refined sugars is highlighted as critical. They're seen as fuel for abnormal genes. Cancer cells are notoriously sugar-hungry, relying heavily on glucose. Limiting this might inhibit their growth.
Cut down on sugar. Makes sense.
For proteins, focus is on quality over quantity. Fish is particularly favored low glycemic index, meaning a slower, more stable rise in blood sugar.
Quality protein, like fish.
There's also detailed discussion about ancient grains, like Khorasan, Kamut, or spelt, said to have less inflammatory gluten compared to modern processed wheat, gentler on the system.
Ancient grains might be better.
However, a significant, important caution is raised against soy, due to concerns about its phytoestrogen content.
Soy. I thought soy was healthy.
It's complex. Some studies, especially in Asian populations with traditional consumption, suggest it might be okay for survivors. But one study at Memorial Sloan Kettering showed soy in breast cancer. Patients could potentially lead to more proliferative cells, hinting at a stimulatory effect.
So, potentially problematic for some cancers.
A cautious approach is strongly advised, especially for patients with estrogen-responsive breast cancer, where modulating estrogen mechanisms, even from plants, could theoretically be detrimental. It's an area needing individual consultation.
Okay. Caution with soy, especially for certain patients.
One source specifically mentions vitamin B16 and B17 as crucial for preventing cancer replication, promoting regeneration, strengthening immunity.
B16 and B17. I haven't heard of those as vitamins.
Right. It's important for listeners to know, within mainstream, evidence-based oncology, B16 isn't recognized, and B17, lay trial, has been thoroughly discredited, with serious safety concerns.
Okay, so handle those specific terms with extreme caution.
Exactly. However, the underlying principle that proper nutritional support with recognized vitamins, minerals, antioxidants is vital for cellular health, immune function, potentially prevention, is absolutely consistent with conventional understanding. The broader point is our cells need the right building blocks.
Focus on the principle of good nutrition.
For patients actively undergoing chemotherapy, particular attention to food safety is vital, especially during the first 7 days post-chemo.
Why then, specifically?
That's when their immune defenses, white blood cell counts, typically reach their absolute nadir lowest point, makes them profoundly vulnerable to infections.
Maximum vulnerability.
So, thoroughly cooking, meats, chicken, beef, no pink visible, is critical. Meticulously washing all fruits and vegetables to remove contaminants.
Cook well, wash well.
Interestingly, it's even suggested favoring fruits growing high on trees over ground-growing ones due to potential irrigation contamination from dirty water.
Wow, that's specific.
It highlights the extreme vulnerability. While raw foods are generally discouraged for blood cancer patients due to severe immunosuppression, they might be okay for solid organ cancer patients if properly cleaned and sourced. But extreme care is needed.
Detailed food safety is crucial during chemo.
And finally, the often underestimated importance of exercise cannot be overstated.
Exercise, right. How much?
Even simple, regular aerobic activity like a brisk walk for 30 minutes a day is highlighted for significant preventative benefits, maybe even more effective than intense running for overall health.
Just a daily brisk walk.
And a compelling study is cited. 4 hours of weekly physical activity reduced breast cancer relapse incidence by a remarkable 20% in post-surgery patients compared to just 1 hour.
20% reduction in relapse, that's significant.
It powerfully demonstrates that consistent, moderate activity profoundly impacts long-term outcomes, inflammation, immunity, and overall quality of life for cancer survivors.
This deep dive isn't just about the intricate science. At its heart, it's deeply human. It vividly brings to light the patient experience, the crucial importance of their physical and emotional environment, and their fundamental rights within the complex healthcare system.
It's a reminder that true healing extends far beyond medical procedures alone.
We learn about significant, heartwarming hospital reforms, specifically highlighted at Hospital Universitario de la Princesa in Madrid. A substantial investment over €500,000, 550,000 euros, to convert traditional double rooms into individual private ones.
Wow, that's a major undertaking.
The ambitious aim. Over 75% private rooms across the hospital. These revamped rooms are designed for vastly increased patient comfort, natural light, adapted bathrooms, comfortable reclining chairs for companions.
Thinking about the companion, too.
Yes. All materials used were specified as healthy materials, creating a truly therapeutic, non-toxic environment. This transformation fosters more personalized medicine, a more intimate, peaceful space for recovery.
The environment matters.
A truly touching detail from one source. A medical student described beautifully decorated rooms in pediatric hemato-oncology, some even with constellations on the ceilings.
Constellations. That's lovely.
Making the often dreaded hospital environment more imaginative, pleasant for young patients. Administering chemo in such thoughtful conditions truly humanizes the clinical setting. Recognizes surroundings contribute significantly to well-being.
That focus on the patient's immediate environment is so critical. And it leads us to consider, beyond physical comfort, what about the patient's right to information, their broader legal standing?
Right, what are their rights?
Our sources highlight practices vary significantly globally regarding information disclosure. In the U.S., for example, it's legally mandated to inform the patient fully. European countries engage in a broader discussion, balancing autonomy with cultural norms. In contrast, somewhere like Venezuela, the approach can be more ambivalent, weighing cultural background, age, context before deciding on full disclosure.
So it varies a lot.
But across all contexts, a strong, unequivocal argument is made for full honesty. Withholding information can severely erode trust, lead to legal issues if a patient feels deceived or their autonomy violated.
Honesty is the best policy, legally too.
In this context, medical records become absolutely critical legal documents, needing precise, complete entries, no blank spaces. Meticulous documentation protects both patient and provider, reflects the profound responsibility involved.
Documentation is key.
Zooming out, while specific laws for oncology patients might unfortunately be lacking in some regions, unlike, say, renal patients, who often have specific provisions organizing into patient associations, is strongly, consistently advocated.
Patient associations, why?
We hear powerful examples. Renal patient associations successfully exerted collective pressure to secure high-cost medications, established direct communication lines with institutions. This collective voice is far more effective than individual complaints, leads to better outcomes, access to information and resources. The state responds more effectively to organized groups.
Power in numbers.
Definitely. The raw, intensely emotional experiences of that medical student in pediatric hemato-oncology vividly remind us of the immense emotional burden.
Yeah, that sounded tough.
Seeing young children face multiple, heartbreaking relapses, enduring severe complications like graft versus host disease. The deep pina, profound sadness felt by the student underscores the urgent need for comprehensive support, not just medical, but psychological, emotional for patients and families.
The whole family needs support.
Finally, our sources directly address oncology care during the unprecedented challenges of the COVID-19 pandemic.
Ah, yes, COVID. How did that impact things?
It's explicitly stated, current cancer patients face significantly higher risk of severe COVID-19 due to compromised immune systems, especially during active chemo. While stable survivors were encouraged to get vaccinated, patients actively undergoing chemo were advised caution initially due to unknown interactions. needed individualized advice.
A lot of uncertainty early on.
Underscores the critical need for ongoing research. Close doctor-patient dialogue about vaccination and precautions, rigorous hand hygiene, social distancing, though often hard to maintain 2 meters, emphasizing masks, avoiding crowds, especially for the immunosuppressed.
Constant vigilance.
And the general advice that oncology patients, like anyone, can get colds or stomach bugs without it automatically being cancer-related, emphasizes their humanity. Need for holistic care, not defining them solely by their disease.
They're people first, not just patients.
Exactly. This also means being mindful of mental well-being, understanding their brain's integrated circuits, their connectome, can be profoundly affected by stress, fear, physical symptoms, underscoring that interconnectedness of mind and body.
As we conclude our deep dive into this intricate world of oncology, it's truly inspiring to look towards the future, particularly in groundbreaking areas like personalized medicine and the relentless pursuit of new research.
These are the frontiers that promise even more tailored, effective, and crucially, less toxic treatments.
Moving us closer to a future where cancer is not just treatable, but often preventable or chronic. The pace of evolution is truly remarkable.
What's particularly striking and promises to revolutionize treatment is pharmacogenomics.
Pharmacogenomics, what's that?
It's a revolutionary approach, tailoring drug treatments based on an individual's unique genetic makeup. Not just theoretical, it's rapidly becoming practical. By understanding a patient's specific enzymes that metabolize drugs, doctors can predict potential toxicity. Will they have severe side effects at standard dose? And even efficacy.
Predicting reactions before giving the drug.
Exactly. Some metabolize too quickly, making it less effective, others too slowly, leading to toxicity. A simple cheek swab can provide crucial genetic info in days.
A cheek swab, that's simple.
Allows preemptive adjustments to dosage or selecting alternative drugs before starting. Truly personalized. Leads to more precise, effective treatments, improving outcomes and quality of life by minimizing trial and error. And this principle can apply to natural therapies too, highlighting its broad applicability.
Amazing potential.
Immunotherapy, aiming to unblock the immune system's own T-cell activity against cancer, is another cutting-edge frontier that has fundamentally shifted treatment.
Unleashing the immune system.
Instead of directly attacking cancer cells, these therapies empower the patient's own immune system to recognize and fight the cancer more effectively. They target brakes on immune cells like PD-1, PD-L1, unleashing natural anti-tumor capabilities.
Taking the brakes off the immune system.
We see a powerful clinical trial example using pembrolizumab for metastatic gastric cancer, demonstrating the ongoing rigorous effort to find new therapies for previously hard-to-treat cancers. It's important to remember, for many cancers, treatments aren't always definitive. Recurrence is possible. Emphasizes the continuous nature of care.
Not always a one-and-done thing.
Which is precisely why clinical trials are so vital. They offer avenues for groundbreaking discoveries when standard therapies aren't enough. Patients are invited to participate, always with transparent, informed consent, freedom to withdraw, highlighting the robust ethical framework.
Trials are key for progress.
So what does this all mean for us, the listeners? The journey through oncology is profoundly complex, incredibly dynamic, ever-evolving. Driven by relentless scientific breakthroughs, seamless multidisciplinary collaboration, and a profound, unwavering commitment to patient well-being. It's a field where every new piece of information, from the molecular level to psychosocial aspects, and that profound mind-body connection highlighted by the connectome, pushes the boundaries of what's possible, not just extending life, but profoundly enhancing its quality. #tag outro.
Today, we've truly journeyed through the intricate and, I think, awe-inspiring world of oncology. From the fundamental biology of how cancer originates, to the cutting-edge tools and treatments, the compassionate, truly patient-centered care, and the essential role of advocacy and personal responsibility.
It's been quite the exploration.
The insights from this deep dive really underscore the incredible complexity and dynamism of this field, showing how every piece of the puzzle, from a microscopic genetic mutation to the thoughtful design of a hospital room, plays a vital, interconnected role in the ongoing global fight against cancer. It's a field of constant learning, adaptation, and, well, unwavering hope, always pushing forward.
If we connect this to the bigger picture, the continuous evolution in oncology, coupled with the growing emphasis on personalized and integrative approaches, suggests a future where cancer care is not just about extending life, but profoundly enhancing its quality, making it a truly holistic endeavor addressing every facet of a patient's being. The ongoing effort to understand every nuance, from cellular mechanisms to patient emotions, and that deep interconnectedness of the brain's connectome with physical health, will undoubtedly lead to even more transformative changes. This profound understanding of mind-body integration, how our thoughts and emotions intertwine with our physical states. It might lead to therapies that bridge the physical and psychological in entirely new ways, ushering in a future of truly integrated well-being. So a question perhaps for you to ponder. How might your understanding of this intricate mind-body connection influence your approach to health and well-being moving forward?
A truly thought-provoking question to consider as you reflect on this deep dive. We sincerely hope this exploration has given you a clearer, more nuanced, and ultimately more empowering understanding of oncology and all its many facets. Keep seeking those aha moments. And remember, the journey of knowledge is always worth the deep dive.